Okay, good. Okay. I'm sure some other folks will show up. It's a beautiful evening, and that is always a detriment to people showing up. So I want to thank everyone who's online, everyone who's in the room. We are, there's no one contacted me to say that there is not attending tonight because of extraordinary circumstances, whatever those extraordinary circumstances may be. Do not have the committee minutes with me. God willing, we'll have the next couple of days. My report is rather simple. We had a really excellent meeting last time, and we're hoping tonight to be able to speak about the upcoming conference. We'll just have to wait for a few more people to show up. So I've been very, very fortunate in being able to get two people that I know so well. Well, excuse me, one I know so well, Pastor Philip Flahy. I have not met Pastor Guy yet, but I'm glad to meet you. I've asked them to come down. They are from Health First, and both of them, and I've asked them to come down and discuss two things. One is the world of Medicare, Medicaid, Medicaid for seniors in particular, the world of Medicare, and a new educational initiative that the Pastor Flahy is working on, which I think is very fascinating and would really tremendously fit in with the Bronx and some of the challenges we have in the Bronx. So, Pastor Flahy, if you could take unmute, and Pastor Guy as well, who would like to begin a presentation right now? Who's here? Pastor Flahy, Guy, Pastor Guy. Hello. Pastors. We also have, we have another person from Health First as well. Faiz, welcome. Hello,
Rabbi Kaplan.
Faiz, good to see you. I can't seem to, oh, there we go. Pastor Flahy, if you could sort of kick this off and call upon your colleagues to be able to give us the background on the whole Medicare, Medicaid for seniors, and certainly the issue of the new educational project you're working on.
Good. Thank you so very much, sir. Thank you for having us. I'm Pastor Philip Flahy with Health First Community Engagement, Health Equity, Faith-Based and Strategic Initiative Manager for Health First. So I oversee the faith-based initiative. I take a lead on the faith-based initiatives and other strategic initiatives for health and wellness within a community. So I have my colleague here, Faiz Karim. It's one of our leaders that have the Medicare, Medicaid, programs. And we have Guy here. I'm going to have them introduce themselves because they are going to be doing the presentation this evening. Well, after that, I will have opportunity to speak on the program that I discussed with you in terms of career development that Health First is trying to bring into the community. Faiz, the floor is yours.
Thank you, Pastor Philip.
Yes, sir.
Yeah, give me 1 second. Rabbi Kaplan, I don't know if you remember me. I was part of one of the Bronx Fellowships many years ago.
I do remember you. Yes, you're part of the We Are the Bronx Fellowship.
That's correct. That's correct. I'm just getting a presentation up and running. Give me 1 second.
You want me to give you co-hosting?
Yeah, I'm going to share my screen. Let me just get this into...
I'm going to make you a co-host so you can share your screen.
Okay.
There you go.
Take it away, Faz. Teamwork.
I don't know you. I don't know you're part of We Are In. So Faiz, you're part of us.
Yes, and Pastor Philip, by the way, Faiz, was part of our We Are All Brooklyn Fellowship.
Yes, sir.
Oh, wow. What a small world.
Small world.
Yeah, definitely.
One second. Let me get this. I just want to make sure you guys could see it properly. So, I will start sharing now.
There you go.
All right, let me know if you guys could see this.
So nothing's on the screen yet,
Yeah,
but
yeah.
I'm sure we'll open up.
Yeah,
There we go.
good. Yes.
Okay, we're good now. We're good now.
Okay. So, Rabbi, we're Health First. We're specifically talking about the Medicare programs at Health First. My name is Faz Kareem. I have you're working with Pastor Philippe, and I also have Guy Sancio. He is a Medicare rep in the Bronx and Manhattan. I am Medicare sales manager for Bronx and Manhattan, and just wanted to review with you, what's going on with Health First, and what we have to offer. I think you all may know a little bit about Health First. We're a program that's not for profit. We are sponsored by New York's leading hospitals, many of the H&H hospitals, Mount Sinai, Montefiore. So they're all sponsor hospitals in terms of sponsoring us. So in that sense, we are not for profit. We are partly owned by the hospitals as well. So, our vision is to treat our members the same care as we would with our own families. There's a lot of slides in here. I am just going to concentrate on the bread and butter of what we do. Again, we concentrate on Medicare. So Medicare, federal program for folks that are 65 and older. You do have people that have Medicare that are younger. If they're on disability for 2 years or more, they do qualify for Medicare. So you do have a lot of younger people on Medicare as well. Different parts of Medicare. You have Part A, Part B, Part C. That's the Medicare Advantage piece. That's us. We provide, we pay the doctors, we pay the hospital, we pay for the prescription drug plan. So you get all those benefits in our program. I just want to jump to something because I know, Medicare Advantage has been around for a while, but there's something very important, especially in the communities, that's going on. There's something called a Medicare Savings Program. And what that is, New York State, they've expanded the federal poverty income guidelines for Medicare Savings Program. So people who did not qualify for Medicaid or low income subsidy, they can now qualify for those types of benefits. And what that does is it helps pay for their Part B premium, which could be $165 a month for your Part B. And that's an estimated savings of almost $2,000 a year. It can help qualify somebody for extra help, which will pay for their Medicare Part D prescription drug costs. It lowers the cost sharing for folks that, in terms of co-pays and deductibles. So what that means is if you're a single person and you make $2,280 a month or less, you qualify for these benefits. And, you see a term here, qualified Medicare beneficiary, that's for Medicaid. If in the past, to qualify for Medicaid as a single person, you had to make roughly $830, $850 a month. Those income guidelines have almost doubled. So there are thousands of New Yorkers who now qualify for full Medicaid. What does that mean? They can get many services at no cost out of pocket. And that's something that's very important. It's a very important initiative that we're doing here at Health First. We're trying to identify folks that who qualify for these benefits but don't know about it. And we have resources at Health First to help them apply for this, right? There's a lot of paperwork involved. And what we'll do is we will help them fill that paperwork out so that they do qualify for this. And when you have Medicaid with Medicare, we call that the gold card of healthcare, right? You don't pay for anything out of pocket, whether it's co-pays for the doctors, prescriptions. You also get, you know, over-the-counter drug programs that help pay for, you know, non-prescription items like Tylenol, Advil, you know, pain medications, allergy pills, lotions, things that you can get at a pharmacy without a prescription, you'll be able to get under our program as well. So 3 different programs that they may qualify for, you know, people with extra help or a low income subsidy. Again, it'll help pay for their Part B premiums. And then the full dual plan, you know, they'll now be able to join our program that has full Medicare and Medicaid. And then, you know, a lot of the seniors, as they get older, what happens? They need assistance. They need a home health aide. They need home care. So qualifying for Medicaid will help pay for that long-term care services. So, you know, that's a big initiative that's going on in New York State. But Health First is one of the few programs that actually has resources in-house that will contact the member, contact our prospects, and help them fill the paperwork out. Now, whether they come into one of our community offices, or, you know, they can be done over the phone. And in a lot of instances, we can send these reps out into the field to the person's home to help fill that paperwork out as well. So that's probably one of the most important things I wanted to get across tonight, because I mean, there are a lot of Medicare Advantage programs out there, so I didn't want to spend all my time just on straight Medicare Advantage. I wanted to spend my time, you know, talking about something that's very unique that's happening at Health First.
So if I could ask you, just to give a little bit more, I know that there's a big debate out there. Folks who turn 65, they see all the commercials, they see all the ads between the Medicare Advantage and straight Medicare. Can you tell what is some of the differences, what are some of the quote-unquote advantages of some program like your Medicare Advantage over a straight Medicare, and how do people make those kinds of decisions?
Yeah, so when you're on straight Medicare, you know, Medicare by itself only covers 80% of your bill, right? You're responsible for the other 20%. There are deductibles. God forbid, if you go to the hospital, you know, you'll pay well over $1,000 for a deductible just to go to the hospital, and then you're responsible for the 20% as well. When you're on a Medicare Advantage plan, our program becomes primary over Medicare, and we pay the doctor, we pay the hospital. You get a prescription drug plan in our program as well. So instead of trying to figure out what this 20% is, you know, it's going to be a set copay. So you'll know exactly what you're going to pay when you're in a program like ours. So it saves you a lot of money on the back end as well, in terms of copays, deductibles, for your doctors, hospitals, and for your Part D prescription drug plan as well. If you're on straight Medicare, and you do join a Part D prescription drug plan, you're going to have to pay a separate premium for that. And then there's a deductible involved in that. All of the programs that we have to offer do not have any additional premium whatsoever. So as long as you have Medicare Parts A and B, you live in our service area, which is the 5 boroughs of New York City, Westchester, the Hudson Valley, Nassau, and Suffolk County, you do not pay any additional premium to take advantage of one of our programs.
Mm-hmm. Okay, and just an additional question on that. I know there's all these talks about supplements for food and other kinds of services. Do you have any information about that as well?
Yes. So, you know, we have something called an OTC card, over the drug counter card. It's a benefit that's available in our programs that where if somebody has full Medicare and Medicare and full Medicaid, they're eligible for this OTC benefit. And the over-the-counter drug card is, again, you can go to a pharmacy and purchase any items where you don't need a prescription for. And that program, and Guy, correct me if I'm wrong, I believe it covers $575 every 3 months.
Yes, the life improvement plan, which is
Yeah.
$525, and
Yeah.
the complete care is $250.
Yeah. So $525 every 3 months. And in the past, you know, you were restricted of only using it at a pharmacy for those over-the-counter items. With Health First now, you can use it to buy healthy foods at participating supermarkets, and you can use it to pay for internet access, you know, through your local cable company, and you can use it to pay for utilities as well. So we've expanded it to not just to be able to be used at a pharmacy, but for other services as well.
Thank you so much. Is there any questions from you guys on this particular arena?
Yes,
Yeah,
question.
please.
As part of Medicare Advantage, is one restricted to physicians and clinics that are part of that program, or can one go and get the same services out of network?
So we have in our program, so Medicare Advantage plan. The important thing to know about Medicare Advantage is, you know, you do save a lot of money joining a Medicare Advantage plan, but there is a network. There is a network of physicians, there is a network of hospitals, and you do have to receive your care in that network. But the great advantage of Health First is, you know, we do have over 40,000 providers credentialed in our program. All the major hospitals are part of Health First. Whenever our reps do sit down with someone, that is the first thing they do, is they check all of their providers to see if they are in network or not. We do offer a PPO program where you can go out of network to see a doctor. There's a higher cost share involved, but it's still better than having straight Medicare. And you do pay a little bit higher, but as long as they accept Medicare, you can go to any provider in the United States that accepts Medicare and use that PPO program. Great question. Yeah, that's something that you have to be very careful of when you are shopping for a
Yeah, that is a good
health
question.
plan. Is you know, are your providers in the network?
That's a good question.
Right.
Yes, very good.
And when you say that you have all the major hospitals in New York, which hospitals, for instance, might you not have in your network?
Pretty much all the major hospitals, Faz.
Yeah, I know.
You
I'm
know.
trying to think of a hospital that's not in our network.
Yeah, I believe all of them, pretty much all of them in the New York.
Yeah, I mean, even Sloan Kettering is part of our program, and we're one of the few programs that has Sloan Kettering in our network. Of course, you do need a prior authorization to receive services there.
But like Faz said, I'll be checking the doctors anyway. We diligently check the doctors to see if the doctors are in the network anyway. So
yeah,
that's the number one rule that we do: check the doctors and the specialists as well.
Right.
Yeah, the only time.
Yeah,
Go ahead, Rabbi. Sorry.
I was just saying, and the Medicare Advantage plan is open to anyone on Medicare, correct?
Correct. Anyone with Medicare Parts A and B. And if they're not sure what they have, we double check. I had reviewed that Medicare savings plan. The other advantage of applying for something like that is there are a lot of folks in New York City who may not have worked to qualify for Medicare. And when I say that is, as long as you have as long as you worked for what they call 40 quarters, it equates to roughly about 10 years. And you pay taxes, your Social Security tax, Medicare tax, you end up qualifying for Medicare when you turn 65. A lot of folks may have worked off the books. They may have been, recent immigrants where they didn't work at all, but they have full Medicaid. We have senior retention advocates that can help fill that paperwork out to see if they do qualify for Medicare, because they'll get Part B automatically. Part B covers the doctors, but they will not get Part A. You will have to pay out of pocket. But if you have full Medicaid, Medicaid will pay the penalty or the premium that's involved. So now they have parts A and B. They live in New York City. Now they can join a Medicare Advantage plan. And what that does is it allows them to go to a lot of private physicians who may not take Medicaid, but do accept Health First. And expands their network for specialists as well. So, I hate to say that, the reality is, sometimes there's two levels of care that happen in the city, right? Folks that have insurance and folks that don't. So, we try to look at all the different avenues and get them all the resources that are available to them to get them onto our program.
Excellent. Thank you so much. If there are no other additional questions, we'll turn, and thank you. Really appreciate it. Good to see you, Faith, again after all these years.
Yeah, good to see you too.
Amazing. I'd like to turn this over to Pastor Fly.
Thank you so much. Thank you, Rabbi, for having us. Out of many other programs that we have, Rabbi, first of all, let me just say thank you because you've been an integral part of our Interfaith Advisory Council. So this is not new to you. So all the programs that we're putting together is to pursue our hyperlocal initiatives. We just want to get everybody involved in what we're doing. And then we are looking at the corporate ladders. We're looking at people in the inner cities, not that they are not really qualified, but they are not even tend to apply just for a job in a corporate to be part. We talk about health equity. So if we're coming to communities, okay, we want to close the gap, but why don't we get involved in it? Get involved in our organization. Our organization have a lot of openings. So we are having these career opportunities where we're having, we call it ride along. Rather than, it's not ride along, we just want to go into community, just, okay, this is what we do in our organization. These are the openings that we have. People sometimes they say they apply, but they did not get the job. Why? Because we look at the way you put your resume together. We want to be able to go out there, let them know how to build their resume, the term they can use in their resume. We want to be able to help them. We're looking at a high school student. We're looking at our college students who really want to go out, who are just looking for career in healthcare organization. We want to be able to have conversation with them. We want to be able to build a mentorship program with them that can lead them to a better place in a career in a healthcare world. So that is what we're doing in addition to that. So we're looking to school, we're looking to students just to encourage them, to be able to, because not everybody is going to be LeBron James, not everybody is going to be Michael Jordan. So we're just trying to change the trajectory in the community. And for other people, for other group that belongs to other faiths, we just want to open it up. So Health First is not only for a certain group of faith. No, we are interfaith. We just want to see every faith, every tradition, every culture in what we do, because those are the people we serve. So if we are serving them, we want them to be part of us, part of the employees too. So that is what the program is all about.
So what age group are you aiming this at?
We are looking at from 18 to 24 and other college students from up.
And how do you go about recruiting for this program?
That's why we're talking to people like you, who has been a father of the whole nation. So we're looking at every faith, we're looking at every tradition, we live in every community. So to just introduce a corporate sense, to bring the corporate sense to them, that you can work in a corporate, you can be a CEO, you can be a director, you can be a vice president in the healthcare industry. But how is the question that people are asking? And that is why we're out there to say, okay, this is what we do. In addition to helping the community, bringing health and awareness to the community, we are building careers too. Because if you look at it, we're short of doctors, we're short of nurses, we're short of healthcare workers, we're short of healthcare educators. So, and then if we don't have all this, how can we just improve on it? We talk about health equity. How can we actually do that? So that's why we bring that initiatives into it, that we want to go to community, at least in a community, to say, okay, we're talking to people, we want to help people, we want to mentor them, and we want to be able to just see, this is how you can go. If you like this career path, we are able to help you. So you can do an internship, we can bring you in here, we give you a mentor that can mentor you through the program.
I'm going to ask a sort of a interesting question around why is Health First so interested in doing this?
wise efforts doing it, Rabbi?
Yeah. Why, listen, this is not your initial mandate. Your initial mandate is to provide healthcare or access to healthcare. Why is this a priority for Health First?
Because if you look at it, we talk about healthcare, we look at let's just say public safety, like you already know, is a collective effort. So we look around this now. We look at Health First. It is not. We don't want to be an organization. Don't want to see us as health insurance giver only. If you look at it, health insurance is just part of it, just probably 10% of the whole issue of health that we have in the community. We look at the social determinant of health. Where you live, your education, other things contribute into that. So why don't we dive deeper into the social determinant of health? What really costs that? Education. How can we bring people up? So if you work in healthcare organization, you will understand much more better. We just speak about all in now. So through the program you bring in now, we'll learn a lot from that. So if I'm going to stay as the pastor, if I don't take that with you, I will not understand much more in the community and how to drive the community. So we talk about health. Health is supposed to be holistic. It's going to be a wrap around, not only health insurance. So that is where we're coming from, and that is what differentiates Health First from other managed care organizations. We are not looking into giving health insurance only. We're looking at wraparound where we can help, how we can improve the community.
Well, that's extremely important, particularly here in the Bronx. Early on, we heard from the borough president's office that talked about healthcare disparities in the Bronx. And as you may well know, I think out of the 62 counties in New York State, Bronx is 62 out of 62 in poor statistics around healthcare. So this kind of program, if you can bring young people from the community into the healthcare system where they speak the language, they understand what the issues are, they can relate to the community, perhaps it can help improve the healthcare statistics for the Bronx overall.
That's what we're looking to do, Rabbi, and that's why we lean on you and all the community leaders, that knows the community much more better than us. So we lean on you, but this is the program that's being open to the community through the field leaders like you, sir.
Thank you so much. Anyone have any questions about the educational system?
No.
Okay, I want to thank you for being with us this evening. And again, we will feed this back into our larger board through minutes and that sort of thing. And again, thank you so much. And Pastor Guy, Pastor Fly, and Cafe, again, my regards, and thank you for being with us.
Thank you so much for having us, and I pray for peace where there's a war. God give us peace. Thank you so much, Rabbi. Thank you.
God willing, yes. Thank you.
Bye.
Thank you.
So, thank you. So, unfortunately, Margaret and others are not with us tonight, so I don't know how we can proceed with the discussion around. I'll have to reach out to her to find out what's going on. The Forum on Hate. I do know we have one little problem. In June, the next meeting was supposed to be during the Jewish holiday of Shavuot.
Oh, okay.
So in the office here, they tried to find another evening that's open, and they couldn't. So they said what we could do is they do like with aging, they do a 4 o'clock in the afternoon meeting. I would have a hard time personally doing a 4 o'clock meeting.
I'm okay with 4 o'clock.
Yeah, so I had to find out from them if could you do it by Zoom? Zoom is hard for me. It's 4 o'clock in the afternoon. It's like prime time. So let me find out what we can do. We may not be able to have a June meeting just because of scheduling issues. So we'll have to figure it out, because that would certainly delay all of our planning quite a bit longer than we really wanted to. Let's see what happens. I will speak to them. I'm very surprised that they actually put it on holiday. I've always tried everyone to do. I said, just go on Outlook and download Christian holidays, Jewish holidays, Hindu holidays, Muslim holidays. Like, I can't tell you how many times I've run into this. A major, I'll tell you the funniest stories, so it's not so funny actually. There was a national conference on cultural competency in healthcare. And it was being held on the first day of Passover.
Get out.
First day of Passover. So I called up Mr. Cohen, literally, I'm not kidding.
You didn't even know, huh?
And he said, well, yeah, well, it's the only date we could get the.
You did know.
And I said to him, how could you do that? First of all, your cultural competency. It's like, then you're excluding an entire population.
Tone deaf.
Not just those who are, you know, particularly religious. I mean, Passover's Passover. He says, well, they didn't change the date. It's just amazing.
Tone deaf. Yeah.
It's just really crazy. So let's see what happens here. So I think we're gonna have a rather short meeting tonight, folks. I'm sorry I had to scarf down your hamburgers so quickly.
No.
But,
Did Miriam want to say something?
Miriam, do you have anything you'd like to add to this evening? I guess not.
Miriam, you're on mute.
She's probably stepped away. In any event, I will find out more about June. We'll figure out when we can actually do if they can do an evening. Maybe we'll just do a Zoom meeting altogether. That means we can do it at the same time as another meeting because we wouldn't need a physical space.
That's right.
So, I don't know what the rules are right now. You know, this is.
They seem to be up in the air.
Yeah, so I know that as of July, the governor's office is voting again, or they're gonna talk again about, how they're gonna handle all this stuff, so we'll see what happens. In any event, just wanna enjoy the rest of the month. And I'm sorry that, we can't discuss the other stuff.
That's too bad.
It is.
I wanted to see how the APOS